much for the introduction. I'd like to start thank Dr. Montagnier for the opportunity that gave to us to present our work and our project. So, what do we know about the HIV epidemic in Portugal? Portugal, according to recent studies, has a concentrated epidemic in men who have sex with men, probably more than 5%, IDUs, inmates, and in-sex workers. And Portugal is the 6th biggest ARV treatment market in absolute numbers and the first in Europe if adjusted for population size. Portugal has 52 HIV clinics. If we compare with Hungary, for example, it's the same size of our country. It has only 6. We conduct with the enthusiasm and the help of Dr. Yvette Calderon from the Bronx, who much support our work with lots of enthusiasm, a seroprevalence study in August 2011 in 3 emergencies departments in Lisbon, 2 in Lisbon and 1 in Porto, an anonymous seroprevalence study for syphilis, HIV, and HCV. These are the results from my emergency department where I work in Lisbon, and we got those figures. I'm not going to say, I think they speak for themselves. HIV infections in Portugal by reported mode of transmission, according to the National Institute of Health, give us this proportion in relation to the different most at-risk groups. MSM accounts for 13.9% for all cases reported. I must tell you that the reported system in Portugal is far from perfect. It's based on goodwill of doctors. There is a new electronic system in place since last year, last months of last year, but we are not going to get results until the end of this year, and probably it's going to show quite a big surprise. This is another way of looking for what's going on in the MSM community, and we can see that the rising numbers of new infections reported according to the different stages of the disease: asymptomatic patients, ARC, and AIDS. Again, I will say that the last years the numbers from the last years are not reliable for sure. If you look in another way, according to the percentage of symptomatic cases, we can see that MSM accounts for 31.7%. The European Men Internet survey conducted all over Europe in 2010 gave us, for the first time, important information on the gay community living in Portugal. 4,546 men answered an extensive questionnaire about many different social and medical issues. And it was striking to see that 27.8% of the men answering EMIs never tested for HIV, and 7.7% were HIV positive. So, getting to the point, or getting to Checkpoint LX, so this is a community-based project which objectives are increase early detection of HIV in MSM, because according to some studies done, Portugal has, I think, more or less the same situation as most countries in Europe, a very big percentage of late presenters. So increase early detection, provide specific information on HIV and sexual transmitted infections, and provide advice, peer support, and referral to ensure effective access to the National Health Service of MSM with reactive results, because we knew that quite a few important percentage of people with an HIV result never get to the hospital, to the clinic. course, the target group is men who have sex in men. We choose to be located in a district recognized as the MSM gay area, the MSM area. It's promoted in bars, saunas, outdoor cruisings, and offers anonymous, confidential, and free rapid HIV screening. But for us, the most important is the fact that it's offered by peers, trained MSM, and not a medicalized testing facility. Of course, we collect information. So, since the beginning until January this year, we performed 2,923 tests, and the majority, of course, were in MSM and MSM, men who have sex in men and also with women. And of course, we cannot close the door to those who are not. Sometimes they are friends of MSM or partners of transgender. So, of course, we test everyone that comes to the door. We are very happy to know that the majority of those who come to our center are very young, under 34 years old, and the median age is 30. Unfortunately, we do have 117 reactive tests if we consider only those who are done in MSM. For those who tested reactive, and the mean age of those who tested reactive is 33 years old, we could see disaggregating for these 6 months. We can see that a big percentage of those had a reactive test, a negative test in the last 24 months. So probably, it's too early to say that, but probably we are getting and diagnosing early infections. One of the points that for us was very important was the fact that we wanted to refer, to have a direct refer to the hospital, to the clinic, and we could settle a protocol with one doctor in one hospital that agreed to receive our patients. So every man who wants to be referred, because some, as you can see, didn't want to be referred for different reasons, but those who want to be referred to this hospital get an appointment, get a date of appointment the day of they have a reactive test. So from the 117, 88 men referred. And we also offer a counselor to escort the person for the first appointment, because hospitals are not friendly places, and sometimes it's difficult to go across all the bureaucratic situations. The fact that we have this understanding with this hospital, we can also have feedback from the immunologic evaluation. So from 79 patients that we now got the feedback, we see that the median CD4 cell count is 456, and the median viral load is 4.7, and 33 patients were started on IRT. Fortunately, we do have a group of people, epidemiologists in the Porto University, that got very excited with this project, and they agreed to settle a cohort, Lisbon MSM cohort, with seronegatives. So until now, we do have 329 participants with one or more follow-ups, 6 cases of HIV detected, so an incidence 2.6 per 100 men per year. But STIs, it's a big problem, everybody knows. So we also wanted to provide this service, increasing early detection and treatment of STIs, syphilis, chlamydia, gonorrhea, and we started also a kind of a pilot project for HPV with PAP, anal PAPs for for detection of and genotyping testing for PCR in real time. This is possible with a partnership with the Tropical Institute of Medicine and the Oncology Institute. So we start screening people with rapid tests for those who state that they never had syphilis, and we obtained 6.85%. We also could start screening people for hepatitis C with a rapid test. We were not sure about this project. It took quite a big discussion if it was in fact a priority. And we set this inclusion criteria because rapid hepatitis C tests are not cheap, and we got 5 infections, so 4% of 125 men that we include in this criteria got a reactive test. 2 are co-infected with HIV. Gonorrhea and chlamydia screens also started. We have 3% for chlamydia and Neisseria, and HPV. It's a project that is ongoing, and we are trying to compare the results from the MSM that are negatives with the results from HIV positive men, and also to see the importance of the vaccine in this community. Fortunately, we have a group of volunteers that help in our work, and one of the things they do is they help us spread out the information, of course trying to reach the most, probably the most difficult to reach in cruising areas. This is around Lisbon. This is a very nice place around Lisbon that is known, it's a nudist place, a nudist beach. It's known as a gay beach, of course, and also in the highway from Lisbon to Porto, where we know there is some cruising areas. So, in conclusion, we think that our project contributes to early detection of HIV in MSM, provides specific information on HIV and sexual transmitted infections adapted to this community, and we think we provide knowledge about the HIV epidemic in MSM with Lisbon MSM cohort. Contributes to the redefinition of HIV prevention strategies for MSM. I don't know if, I doubted that there was a prevention strategy for MSM in my country. There is a problem, sustainability, money. We are a country with the intervention of the, as you know, of the international monetary funding. So all the lines of funding for NGOs are completely freeze. And we don't know when it's going to stop, if it's going to start one day. So if you know someone that is interested in funding our project, let's get, you said that it should be get funding. No, it's the point.
We can wake him up.
Talk to me, talk to me. I have to thank all these people. This is the peer team that are wonderful guys. This is the checklist team, and I have to mention this is this group of young doctors who volunteer, gay doctors who volunteer to be at checkpoint every Thursday from 5 to 8 at night. And of course all the other contributions, the doctor, Eugenio Teofilo, who agreed to receive all our patients, the Oncology Institute, the Institute of Tropical Medicine, the epidemiologists that they do that work for free, imagine. And all the volunteers and volunteer group that agreed to spread out our work. Those are the contribution for our work. The pharma, of course, they have to give money, and the community projects and business in Lisbon. And this is the team. That was the Ministry of Health when we started She's No More. And thank you for your attention.